Welcome to this episode of the Biology of Trauma podcast. I'm your host, Dr. Aimie. We're diving into a fascinating frontier of medicine that seems to help explain why traditional approaches for trauma and chronic pain sometimes will fall short. If you are a listener of this podcast or taking one of my courses or met with one of my health or trauma coaches, you already know that trauma and overwhelm leave their mark on the body in ways that talk therapy can't reach. In this episode, we are going to look at a specific part of our anatomy and physiology that talk therapy will not be able to reach, but that is part of our mind-body connection. This is the fascia and extracellular matrix. We will be answering the question, how does trauma impact these hidden spaces of our body? You've likely experienced the mind-body connection yourself or in your practice. This is the idea that emotional stress shows up as physical pain, or how physical treatments sometimes trigger unexpected emotional responses. One reason for this physical emotional connection is due to our fascia and extracellular matrix. So this episode was important for me to share with you because it is part of our anatomy and physiology that until recently has been largely overlooked. And don't worry, if these are new terms for you, you're not the only one and you are in the right place. This episode is going to break down these essential systems and their connection with our emotions and nervous system. What's exciting is that this knowledge gives us something practical to do if we have a chronic health condition or if we are in therapy and on a trauma healing journey. The aspect of fascia and the lymphatic system became really important for my friend, Dr. Christine Schaffner. She is a board-certified naturopathic physician treating patients from her clinic in Seattle, where she uses innovative therapies that focus on the body's natural ability to heal. So she is my important, distinguished guest for this episode, where you will learn how trauma is stored in the fascia and extracellular matrix, how fascia impacts everything from chronic pain to emotional resilience, why lymphatic health needs to be part of trauma recovery, why a detox can cause emotional responses, how to safely approach detox, and practical, simple steps to support your body's healing process that you can do at home. So whether you're an expert in fascia and lymphatics or are new to the topic, or maybe are looking for new ways to address trauma stored in the body, this episode is an important one to discuss these hidden spaces in our body, but that also get impacted by overwhelm. Let's dive in. This is a really important piece that when you're in movement, you really are working with this full extracellular space that is really where it provides so much of the communication and messages to our cells, and whether they are stuck in that cell danger response and survival response, or if they're getting communication and messages that, we are safe, we are good, we can grow, we can be creative.
Yeah, no, absolutely. Really well put. And I think giving people this resource, because it's, some people might even know that they've had traumatic events in their life and they might have seen a counselor for so long, which is a huge part and really important, right? But they might not have made that breakthrough or that result in improvement that we all want for them, right? And so, that's typically when we also say like, okay, let's explore these other realms of, looking at how trauma is stuck and stored in the body and how we can give you a safe container to release it. And also just to that other point, if people are in pain, and if you're in pain or if you're in any stuck pattern in your physiology, this is always a place to look. Because again, I'm sure you see the same patients who have tried everything, right? They've done all the diets. They've, remediated their home. They've gotten their amalgams out. They've, done all the things, which is awesome and really moving them towards health. But at the same time, if they're not getting the results that we all want for them and haven't looked at this piece, this could be the piece that gives them the right. Yeah.
And this kind of leads right into a discussion then around lymphatics as well.
Yeah.
And how important maintaining good, healthy lymphatic flow is for anybody who's doing any kind of emotional work. And again, just like the fascia and the extracellular matrix, they're interconnected, right? Like you can't separate what's happening on a biological level from what's happening on the psychological level. And so talk to us and explain to people the importance of lymphatics, maybe even starting for some people on what are we referring to when we talk about lymphatics.
Yeah, Absolutely. Thank you for asking. This is one of my favorite topics, and it is really the space where trauma can live. And also, when we get movement with trauma, it's swelling, and then we have to address all the other things. So, I think it's really relevant and important. And so, the lymphatic system is just this, body wide network. It has lymphatic capillaries and nodes and vessels and organs and glands. And it's really its job is to essentially it's a waste removal system, and it's also an immune surveillance system. So those things are happening in that space. And to take even a step further, it's tied intimately to our circulatory system. So we have the oxygen rich blood leaving our heart through our arteries, and then as we get to the matrix, as we get to that tissue space, the arteries become capillaries, and a lot of fluid leaves the capillaries, and some of it returns to the veins and gets recirculated to the heart. But a lot of it stays in that extracellular matrix, and it's called interstitial fluid. And then that interstitial fluid brings oxygen to our cells and removes waste. And then it makes its way to the lymphatic capillaries and drains into the capillary system to make its way through this one way valve system and network system back to the heart. So, really, to treat the extracellular matrix, we have to have really good lymphatic therapies on board. And so lymphatic therapies can include a lot of different things from, movement to rebounding to dry skin brushing to the washards to topicals to herbs. And as you have mentioned, is that, again, this is a system that I really often see a lot of chronically ill patients still don't understand quite how important it is, or some, of course, well-intended practitioners don't highlight enough. And so this could be a system that is really stuck and sluggish and congested. And, part of one of the biggest strategies I do when I start working with someone is move their lymph, get their lymph draining, get the stuck energy, get the toxins, the pathogens out of the tissue space. And with that too, we can also, again, remember memories are stored in that space, trauma is stored in that space. So you can often have a lymphatic therapy and be overwhelmed by an emotion, a thought, a feeling, and that's a good thing. We're excited when that happens. Sometimes, I do also this technique called neurotherapy in the office, and it's a German injection technique that addresses all sorts of different things. And I primarily use it for scar therapy. So when people have scars on their body, so an appendix scar or a C-section scar, that can disrupt the flow of lymph in that area. So just from a mechanical perspective, the scar tissue can affect the fascia, the lymphatics, but it can also hold a memory of the emotion around how that scar was formed. And so a C-section scar is a scar I often inject. And, the experience often some, patients will have is when that is injected, they feel movement in their body in a way that they haven't felt, but often there can be a release, an emotional release, and and a very intense one. And my patients will sometimes say, like, "Oh, I'm so sorry." I'm like, "No, this is exactly what I wanted you to have. This is perfect." So that's a great response. And so again, that is the feedback that my patients have given me to show the reality of these concepts that we're sharing today.
And just like when we give more attention and support to the lymphatic system, and with increasing that movement, there can be some movement of the emotion in the body. Same thing when we're doing emotional work, there can be release of toxins and other stuff that's in our body. And we need to be supporting our system in that way. We need to be taking certain things, right? So talk to us about that. Like, why would it be important to be taking binders, for example, if you're more on the therapy side of things and doing some emotional work, and with that movement of emotion, expecting to have some movement of other things like the toxins and stuff that also get stored in our body?
Yeah, no, and this is a great question. And I see that often, like, people will be plateaued with their therapy, right? So they'll know that they have, let's say, a high mercury level, but you do have, urine test and they're in a retention level. No mercury is coming out, right? And, they're taking all the minerals and all the stuff. But, then we do some emotional work, or they see another provider who does a lot of wonderful trauma healing work. And then all of a sudden,
There it is.
and there it is. And they're going to have symptoms like they're going to be like, okay, the example with mercury, it's going to be more neurological symptoms, or even these ups and downs with emotion. And, that's the time to really go in and start treating those toxicants. So with your mercury mop up, protocols with the sometimes chelation or the binders or the liver support. And so that is something that I really commonly see. And then on the flip side, it can be not only alongside a toxin, it also can be I a lot of stealth pathogens, right? So it can be around the immune system. So Lyme lives in the connective tissue and retention. So many of the co-infections, viruses hang out in that space and in the lymphatics. There's a lot of
Mycotoxins.
yeah, exactly. Mold toxins. And so, we really, they go hand in hand. And that's why I love this conversation is like, you can't do trauma alone. You can't do biology, but you have to do them together to enhance and amplify their effects and to really move someone towards health. And so whenever you're doing trauma work, you should go take some binders and, whatever your detox protocol is, your immune support, go get an IV, all of those things can help you navigate that. And then, as we just said, if you're stuck and not getting the results that we want in that chronic illness world, open up to this other realm with this huge toolkit. There's so many tools in this world, which is so exciting. And it's really finding the tool that works for you. And I always say it's the right time, with the right support. And, and just be gentle with yourself. Your body might not have been ready, to look at this until this point, because it sometimes can be too much to expose this trauma or to release this before the body's ready as well.
Exactly. Ready biologically. And I think from my perspective as a medical physician, this is one of the most misunderstood things about trauma is that it's something that's just in your head, something that's just affecting your psychology. And the approach would just be, to go to a therapist and talk about it or go to counseling. And it's like, well, when we're dealing with the body, and especially like you, like me, we have someone who's coming in with symptoms of a physical condition, symptoms of even a physical disease. Maybe it's progressed that far to a disease. And we know that even though it's a physical manifestation, there is always an emotional component to that just because the mind and the body are one thing, right? Just like what we were talking about, whatever is happening on the psychology side thing is a reflection of what's happening on the intracellular and extracellular side of things as well. And once we understand that the trauma then is really a freaking biology, not just psychology, well, then when we're working with someone who has symptoms and maybe getting stuck in their healing process, and we want to bring in some of the emotional work, it doesn't mean go and see a therapist. It doesn't mean go sit on the couch, rehash your childhood, try to figure out, did you feel secure? Did you not like your mom? Right? Like those are still, after all these years, what comes to mind when people think about doing trauma work or doing emotional work. And it's like, no. Like we're actually still talking about working with the body. We're talking about working with how the trauma has been stored in your body, how the trauma has affected your biology, the adaptive mechanisms that your body has had to do to kind of take on that burden and carry it for so long. We're talking about finding ways to work with your biology in a way that it's right for what it can handle at this moment. And that's where it does become very individualized. You can't just, give a protocol to everybody in the world because we're all so unique from our genetics to our epigenetics, and then let alone to our life experiences, our diets, our lifestyle. We are so unique, and each of our bodies has a different level of capacity then for any of this work because it's not something that happens overnight, right? It's something that we gently nudge it towards healing and providing it all the support and the nutrients that it needs, both on a physical level, on an emotional level, and then it starts to reorganize itself. And that's when I think of the extracellular matrix. That's kind of what I think of as it's reorganizing itself to be set up in a way, the framework now for the cells to be supportive, to be healthy, to be coherent, rather than having this either collapse because of exhaustion or really tight tension because it's still in sympathetic and anxiety state. There's so much of that structure and framework that happens when we can provide it both the physical nutrition through supplements or diet or whatever person's specific biological deficiencies or toxicities are, and then providing that on the emotion level so that the nervous system can actually feel safe in communicating this message of, okay, we're safe, we're secure, we can start this reparative healing process for our body.
Yeah, no, I love that. It's really well said. And I feel like summits like these and the work that we're doing, it's really the shifting the paradigm, right? Of how we, look at our physical health. And I feel, in some level, with what the world's going through right now, there's the opportunity, right, to look at new ways of healing, new systems of healing, and really what is the ideal care team for
Yep.
the average person who needs their health supported.
Exactly. And yeah, thank you for bringing it up because when I look at even the long term kind of downstream effects of COVID, even on the body, I see that those who have this stored trauma and burden and stress on their body already, they're going to have a harder time managing that because it's just going to be one more burden that the body is having to deal with, one more thing that it's, kind of dragged down with now. And it's going to have less of an ability to then handle stress. So you may find yourself feeling just your stress tolerance is lower. You're more irritable. You're snapping at things that you used to be able to kind of brush off, no big deal. And now all of a sudden you can't. And recognizing that, hey, like this is just a sign of this accumulated trauma and burden on the body that you can do a lot about. Like we have so many tools available to us. So I'd love for you to speak a little bit more. You mentioned it, but I'd love for you to speak a little bit more on when a person is doing work, right? And then all of a sudden they feel like their symptoms are getting worse.
Yeah.
And I think that, we kind of call this a healing crisis. And when is that a good thing? And when would you as a practitioner say, ooh, I think we've pushed our system too far. Let's go back and be more gentle. So share us your thoughts on that.
Yeah, that's always the line that we walk right in practice is like, how do we, push a person's body to movement, to flow, to resilience, all of those things. But, in the time that their system is ready and that dance, right, that we always make. And so with any protocol that I do, I really am mindful of supporting people with a foundation of binders and supporting organs of elimination. And, the naturopath in me is always, making sure that they have, a lot of detoxification strategies at home, too. So that can be anything from casserole packs to, using the bathtub in ways to support detoxification. Some people have saunas at home to coffee enemas, and just different tools that will work for an individual. And there's so many home tools now available, but those are some basics. So, making sure that either if their patient's local and they can come in and be supported, or if they have, things at home that they know their resources in their toolkit. And so typically if someone's having like a healing a crisis from a traumatic release, there could be just more, it's not necessarily a new symptom. It's usually a flare in their current symptoms that I see. And so with that being said, I usually navigate and increase some of the things that we already have forward and working on. And then, of course, stay in good touch with the patient. But again, I being the naturopath too, I use homeopathy and I use flower essences and I use essential oils and I use things to stabilize their field and their and help to ground them. And again, if they have access to us and are local, it's not that you just have this release and then we say goodbye, week later, like you're in the office.
Good luck.
Yeah, you're in the office, you're doing a little bit more body work. You're laying on the bike mat. You might be doing sound therapy. So we're trying to, help integrate. And I think the interesting part of this work too is that when we talk about trauma, it can feel, and with all respect, because I do understand this, it can be heavy and hard and long, right? And so it can be in that way, but it also can be, there are these moments of, it can be a huge cathartic release and a like, oh, you kind of pass that, like it's just like that kind of leaves you, not to say there isn't aftershocks or residuals that need to be integrated into you. But I think sometimes just the awareness and the being seen shift somebody so dramatically that 10 years of therapy, tried to do, not to say it wasn't, leading up to this moment. So it's just kind of that dance, of course, of making sure people have their resources, their whole communication, they have their tools. that we support them. Yeah, just it's also the beauty of healing, right? That, on the other end of that, there's, the lights at the end of the tunnel, right? The connection, there.
Well, and that's really how I know that we're dealing with something that's related to trauma. When we talk about trauma, like that's why it got there in the first place, is that at some point, right, we felt that we were both unsafe and unsupported.
Mm-hmm. Mm-hmm.
If we had felt safe and supported, it wouldn't have been a trauma to us.
Right.
Right. And
Right.
so when I see symptoms either resolving or even just alleviating and getting a little better with that piece of just now feeling safe and feeling like you have the support, then I know that, like there's a component of this, not all of it, right? But there is a component of this that is trauma related. And when we work on that trauma piece, that will help with this overall condition and these symptoms. And so when we see these flare ups, like, yes, that's a huge piece is where, where is your support? Where are your resources? Are you feeling well resourced? Or are we back in your trauma place where you're feeling unsafe,
Right.
unsupported? And then, this is not the right thing, right? Like we are not doing a good thing here. This is not actually, a healthy catharsis. This is actually just regurgitating all of this trauma patterns and making your cells and your extracellular matrix go right back into that cell danger response and go back into its trauma place where it's small, it's frozen, it's actually terrified and doesn't want to be seen, doesn't want to, open up and be vulnerable because even that just doesn't feel safe.
Mm-hmm.
And so that's for me kind of like what you're saying, like that's for me, the signs that I look for is this a healthy release? Is this moving us in the right direction? Is this healthy movement? Or was this so much of a shock or a change and your system wasn't ready for that we're back in your trauma place and we need to build that piece more slowly so that you can go through this feeling and knowing that you have support, that you have resources, that you are safe. Because then with that, there's just so much more capacity for the body to heal itself when it is in that secure state of being.
Mm-hmm. Yeah. Yeah. No, I completely agree. And I think, sometimes there are these well-intentioned providers that, sometimes they go somewhere, either without the right support or at the right time. And it's not, it's just experience, that, like we're saying today, it's just like that needs to, like it needs to be in the context of a team and support so that you're not, poking at something that's either not ready or a lot of support when it's opened.
That makes me think of almost nearly every patient who walks into a typical doctor's office and they're leaving most often not feeling like they're well supported, like they've really been heard and listened to. That's not how the system is designed. I mean, there's only 15-minute appointments. Like how can you actually ever get to that point where you feel like you've been able to be seen for exactly what's going on, understood, and then supported in that way? And so it's almost like the medical system really leaves people short, especially when it comes to addressing any emotional or trauma components of their symptoms, because they never even are able to come near to that place of feeling both safe and supported by that medical team in order to be willing to open up that Pandora's box of the emotional component underneath their diseases and symptoms.
Yeah, there's no space for it, right? And paradigm. When I, connect with patients often, it's, the traumas of life that maybe make us vulnerable to being sick. And then I think in our patient community, it's really the trauma of being sick, too. So it's like layered experience of just years of being, unseen, unheard, dismissed, my patient.
Dismissed is a big one.
Yeah. My patient today, was just saying, and she is really quite sick with very physical symptoms. And she's in Europe and she was just saying how, the provider, the GP was like having, I think you need to have a psychiatrist on your team, speech. And it's just like, that can be so damaging to hear over, it's very gaslighting to these patients who are in their body experiencing very real symptoms. And yeah, just being told like, oh, it's just in your head, So it's yeah, it's a story that's all too common.
Yeah. Yeah. Which
Mhm.
is why I really love and respect the work that you do and kind of how you have chosen to show up and help people in the world.
Well, thank you for saying that, and you as well. And no, I mean, I love this work. I love our patients. I feel really honored that I have the team that I have and the patients that I have who trust me. Collaborating with them. I really feel, Amy, the work that we're, all doing collectively together is really creating a new paradigm for healthcare because it's so needed right now.
It really is. It really is. This is a big gap that has needed to be filled for a while. And there is that, like I see it too. There's like this team of providers and practitioners kind of rising up and starting to fill this gap. And it's really beautiful and nice to see.
Yeah, absolutely. Absolutely. Hey, we're in this together.
Absolutely. Yeah. Whether we like it or not, we are in this together. So let's figure out how to help our bodies release old stuff and then prevent the accumulation of new stuff, right? Because life will continue to be life. And it's about helping our biology be at the place where it can handle stress and it not become traumas and it's not something that we hold on to like we did in the past. But we've got the movement, we've got the vibrations, we've got everything aligned for that level of health and aliveness that we want in our life.
Yeah, love that. Agreed.
So, Dr. Schaffner, how can people find you and your awesome work?
Oh, thank you so much. I have a website, drchristineschaffner.com, where you can find out all about my practice and my podcast. And my practice is Imminence Health, and we're in Seattle, Washington, and we do telemedicine as well all over the country. And yeah, you can find out more about us there. So thank you.
Awesome. And thank you. Thank you so much. It's been a big honor. And thank you for tuning into this episode of the Biology of Trauma podcast. If you would like to know more about how to effectively release trauma from the body, then you will want to browse the links in the show notes. It is not an easy process, but it doesn't have to be as confusing when we know the science that gives us the sequence and the structure and the essential elements to integrate so that the body has what it needs to release its survival patterns. I will have the link to my guide for the essential sequence. This will give you the science of the body's instinctual trauma response. There are 5 steps, and that will give us this sequence for what the body needs to come out of a chronic trauma state. If you are looking for something practical, not just knowledge, but something practical, and to start working on that body level, then you will want to look at a 7-day self-paced somatic exercise course, and that is called the Guided Somatic Healing for Stored Emotions. I guide you through 7 somatic self-practices of the main emotions that I have seen in my patients that are behind all chronic illness, including pain, fatigue, autoimmunity, digestive issues, and other conditions. I also have a related YouTube video on this sequence, and I go into this first step of the essential sequence, which is creating safety. And the video itself is called Why Feeling Safe is Essential for Healing the Body. But I also have some podcast episodes you'll want to check out if that's your thing. Episode 96 is on the emotional aspects of chronic pain and the 3 questions to ask to release it. Episode 74 is also a good one, why it's on how trauma stored in the body creates syndromes. And that is with Dr. Peter Levine, founder of Somatic Experiencing. With that, I am here to save you time and money by bringing you practical information that will help you accelerate the journey to our best health and our best selves. So please take a moment to subscribe, leave a review if you have already subscribed. Your reviews and feedback are how I know how to improve this podcast, bring you great content, and help you find information that will change your life. I'm your host, Dr. Aimie. Until next episode, lots of love.